Qualified, professional, and compassionate doctors talking real solutions to real health problems.
It's a new virus and we don't know much about it yet, but
it's everywhere. It doesn't make a sound. The person next to you, even you yourself, could actually have it. This is a highly infectious agent right now. And as we have seen from this second wave in Uganda, it's highly transmissible.
COVID-19 is going to be with us for a long time. And we need to prepare to live with it. And living with it requires that we comply with the SOPs. It requires that we vaccinate. And when treatment, which is definitive, comes on board, we embrace it.
For infection to happen, there has to be someone who is vulnerable and someone who has the disease.
the spread is mainly by what we call droplet infection. But for purposes of our viewers, I'll simplify it as you cough and then the sputum or what jumps and it falls on the person in front of you, the one you have coughed to. That is one of the methods, especially passing through the soft tissues, the eyes, the nose, and the mouth. So that is one of the commonest.
The droplets, because they contain some bit of water, they are relatively heavy. So when you cough, it can move just about a meter. So they will drop down when somebody coughs.
And then somebody comes and touches here and then contaminates his fingers. And then later he touches his face, the eyes, the nose, and the mouth. So, and then he gets it.
The main reason why this lockdown, including also the social distancing, is implemented is that we stop this action, that I am unable with my infection to infect another person.
You stay where you are
we
with
stay
your
where we
illness
are.
until you recover.
And two, from the time I am infected, it takes, usually the symptoms develop 2 to 12 days after. And during this period, I am more likely to spread this disease. But from the time the person is infected, within 2 to 5 days, that person can actually spread the disease, whether with or without symptoms. Now, depending on how good your immune system is, your body may control this infection and you may not show any signs. You may not fall sick.
They may not. So there are people who can get the virus, but
Yeah.
they don't have signs.
They may not have signs. The body controls it, fights it, and it passes away. Or you may just have a period where you feel unwell a bit, but
As if
it may
the
pass
flu is
away.
coming, then it goes away.
It may go away. But it may also have mild symptoms. So like the usual flu, you may have a sore throat, you may have a cold, your nose may run, you develop a cough, and some fever, and it may end there, just like the other flu.
Just like that.
Appears to be slightly different or different from the other types of flu is that its likelihood of causing a higher fever, causing a dry cough, and then invading the lungs and causing difficulty in breathing. That person
so it
feels
like a pneumonia.
Yes, like a pneumonia, like you just fail to breathe. You really struggle to breathe. And many of the people who are dying is because of the breathing complications which they do get. So our bodies are designed in such a way that when a foreign object, a germ, enters the body.
Like that coronavirus.
For example, the coronavirus.
When it enters the body.
So the body recognizes it. We have the white blood cells and other cells in the body which fight germs, which fight foreign objects, any germ, whether bacteria, whether a parasite like malaria, or a virus like corona. The body tends to recognize these things and know that this is an intruder. And these intruders will not be in our system.
So that's the immune system.
The immune system, our immune system recognizes it and puts an arsenal to play. And these arsenals include some cells which actively comes, gets these intruders and kills them, or they produce antibodies. And these antibodies coat the arsenal, limit its movement, restricts its movement. It's like you grab and and then you have these cells which come and kill them.
So in other words, the immune system of the body kills
these viruses. Okay. So over the course of the period, the person initially, the first few days, the body will not have recognized or will have not built enough immune response to develop and restrict or kill this object. And it may take a few days before the body puts this together. And so you start feeling unwell, you may have the cough, you may have the sore throat, and you may develop eventually the difficulty in breathing. But when the body organizes itself, and then it's able to put up a fight. It's a real war. Yes,
and it's ready to start.
Yes, a real war within your body. Then it moves, it controls it, and at the end, it defeats the virus. Now, if a situation arises where your body's immunity fails to kill the virus can really throw you down, or it may even kill you.
So when we are infected with an infectious agent, a virus, for example, COVID-19, the coronavirus that causes COVID-19, our body responds, it fights back by building up an immunity through whether it's cells or we call them antibodies, to be able to fight back. And when we recover, our bodies retain a certain memory that allows us to quickly recognize and fight back when the same agent attacks our bodies again. So this is what happens when we get vaccinated as well. Yeah. You can use a vaccine to activate our bodies to also develop that defense mechanism. So we can get that defense mechanism either through a vaccine or natural infection. Okay. Now, when that happens, you as an individual, we could say you are immune to this disease and you might not get it again, or if you get it, perhaps it will be more mild than someone who has never got it before. Now, when you have several people within the community that have that kind of defense mechanism, you get to a point where the disease cannot easily move from one person to the other. Okay. But when you have a significant proportion of people in a community that are protected from that disease, either from due to vaccination or a natural infection, then you could say you have herd immunity when it gets to that point where you don't have transmission literally happening because there are so many people that are protected. Wow. Now, this might vary based on the disease you're dealing with. It might be 60%, it could be 70%. At the beginning of this pandemic, when we were modeling what proportion or percentage that would be, many people thought it could be about 70 or 80% of the population. Now, you realize that that's a very big proportion of a population that needs to be protected for you to stop infection just using herd immunity. Okay. But you also need to note that you cannot do an experiment of herd immunity acquired through infection when you're dealing with a disease where many people will die.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Okay, like we mentioned earlier, we started first of all by testing people at the airport who were coming in. But mainly it was those who showed signs and symptoms of the disease. First of all, I want to inform the public that the biggest problem, would love to test each and everybody. But there's a big problem of test kits the world over. The reagents for testing this. Even in the world, there's a big competition for getting these reagents. So now, the few reagents we got, we have to prioritize whom do we test. And initially it was all those who met the case definition. If you came with a cough, with a fever, with a flu, and had traveled, then you were a strong candidate for testing. Then we moved on to test all those who are quarantined, because if you are quarantined, you had to be tested before you are released. Then all those who had returned. You remember when we got the Dubai cases, we realized that we had people who were in the community that are now surprising us. So we had
you had to track all of them and
get them back and test them. Now we have moved on to test the truck drivers, especially those. Now that the borders are closed, the airport is closed. So the only people we have who are coming in, as you remember, the people who will bring this problem here would be people traveling in from outside. So now the truck drivers.
And the truck drivers are being tested.
They are being tested.
Okay.
And then we're also now testing our health workers who are treating these cases. Okay. Like we tested all the health workers in Entebbe, and all of them were negative. Okay. We are going to test all workers, which shows that they are following the case, infection control methods. We are now testing all the people in Mulago who are managing the cases. But also contacts, the contacts of the positive cases. We follow them, but then test them. But if they don't develop the symptoms, we don't test them.
All right, that's very good. So after the break,
the other group being tested are the people who initially tested positive, and so testing is done subsequently to ensure that, to check that one, they are getting cured of this virus, and before they are released into the community, that they have 2 negative tests, so that you are sure that they are not going to, when they go back, they do not transmit the disease.
Of course, there are studies which were going on, but many of those studies have not been conclusive, have not been verified, and it's really not confirmed that chloroquine can help. So at this juncture, you have helped me. I want also to advise the general public, because I know people have been rushing to the supermarkets to buy chloroquine.
Or haven't they finished all the chloroquine?
They may have finished it even in the market, because I'm told it started at 20,000, went to 200,000. I'm told it is over 300,000. It's not really confirmed. There are no studies which have confirmed it.
And the people in Mulago, in the treatment centers, were using chloroquine.
We are not using chloroquine either. Yeah.
So
I would advise the public not, first of all, to stop treating themselves, because people may be getting a slight flu, may be getting a slight fever, and start swallowing chloroquine. So that one is not yet confirmed, and it's not a treatment guideline as far as the ministry is concerned yet.
And even to put this further in perspective, many of these people have been taking the chloroquine that it will prevent either COVID or it will prevent the complications of COVID. Really, there is no evidence that it does.
There's
in
no
any
basis.
case, it is no
scientific basis.
Chloroquine does not prevent you from getting COVID disease.
Most of those patients, as you know, it is a virus disease. And as of now, there's no concrete cure for killing that particular coronavirus. So we are doing symptomatic treatment. We support the patient, fluids, painkillers. If there is a temperature, we give tablets like Panadol, which will reduce the temperature. And then we have also been giving ascorbic acid, as it has been seen.
I think that is vitamin C.
Vitamin C.
But we have lots of vitamin C in
we have
the
lots
market.
of them in the
For
market.
all the fruits we
eat,
those are vitamins.
Yes.
Okay.
So generally, that's the protocol.
That has been the main
using.
treatment.
But also we treat if there are other diseases which the person has. Like a number of them who were in Mulago had other diseases, like diabetes, they had hypertension, and we also treat concomitant diseases as well.
Okay, so you treat the patient as a whole. You don't only focus on the corona.
On the corona.
But you treat everything else.
Exactly.
Stigma is not anything new in Uganda.
Yes.
We know stigma. What needs to be done is to equip the society. What we need to tell them is other things they need to do to deal with a person who they believe has, might
actually be already confirmed.
Exactly.
And has returned.
Exactly. So I think we need the medical people to help us simplify.
So that conversation needs to begin happening
now.
Probably beginning with the already confirmed and curing and returning the community.
Yes, so now we need to start talking to the community.
And then we step back, say, there are some patients who are returning, they are cured, tested negative.
Yes.
There are those whom we have taken, they are positive,
and
we've treated,
but
they are still...
And there might even be people among you now.
So that conversation needs to begin happening.
So we need to transfer the responsibility of managing this situation from the medical guys to the society.
Yes.
At least the spread management and the initial parts of it. Let's say in my house, if I had a coronavirus patient, are there things that I can do which don't need medical knowledge for me to do them? You will have social participation in managing some of these asymptomatic cases.
But for those who have symptoms, what we have been saying is, if you have a cough, if you are, and you have, or you have difficulty in breathing, and so on, that you should not come to hospital. Do not get into public transport and come to a health unit, because along the way, if it is COVID, you may spread it to people you may have contact with. Instead, you give a call to the numbers which are identified in each of the districts. There are some numbers, whether you here in cases here, there are some dedicated numbers. And some people, and you give your location, somebody will come and take a test. And so this test turn out positive. They will inform you, and currently they will pick you and bring you to one of the treatment centers.
Yes, after 2 weeks of treatment, which I'll be explaining what we've been doing, we do 2 tests, repeat tests, which my colleague was talking about. If you get a negative test, then we put an interval of another 24 hours, and then we do another repeat test. If you have 2 negative tests 24 hours apart after 14 days, and you don't show any signs and symptoms, and your tests are negative, then you are good to go, and we discharge that patient. Because the process of discharge is a bit different. You have to prepare the home where you are going. We have to give you some information. Okay. But on top of that, we also have to go to visit you every day for the next 2 weeks.
The discussion, the way the medical people prepared us, discussed and took us through the disease and how to manage it, has not been properly done on the economy. There's definitely a contraction because you have sectors of the economy that are just not working. I mean, tourism is closed, aviation is gone, schooling is gone, transport was dead. I mean, many sectors. I mean, if you ask me from the media, I know exactly the pain that has been inflicted on us. An economy is built by healthy people.
Yeah, absolutely.
If people are unhealthy, they cannot engage in meaningful, productive ability. Look at Rakai. What happened to it? Rakai was totally devastated. So we need to first be assured
that we are
by the health workers that this situation is manageable.
Survival, livelihood, we have problems. If people are not able to feed well, in the next few years, we shall be getting into malnutrition again. The indicators will go down. So COVID has disrupted the social determinants and other determinants of health and well-being. And we need to look at it in a holistic manner, especially as we move towards the recovery period. That is really, really going to be crucial because disrupted determinants of health today is disease and death tomorrow. And it could actually be worse, depending on how we handle it. So as part of the recovery plan, we need to be thinking about how we can stabilize now, even as we try to come out of the pandemic, but especially how we can create that resilience, not only for the health system, but also that resilience for the communities and families so that they can survive, because that is really crucial. It's part of health.
You are watching the Doctalk Show. You are watching The Doctalk Show.
The key intervention is providing information, creating awareness and raising awareness, in which case we want also to thank you, the media, especially. You have done a lot of good job raising this awareness. So what is important is to tell the people.
We need to adhere to the SOPs if the course of this epidemic is to be reversed.
So it's mainly the same interventions like wash your hands with soap and water for at least 20 seconds, or use a sanitizer which must have at least 80% alcohol. Wash your hands as regularly as possible. As you touch these surfaces like this, wash your hands. Stop handshaking. Stop hugging.
Like physical contact.
Physical contact.
Any kind of physical contact
please avoid it.
Okay.
Social distancing, like you have said, at least 2 weeks, two meters apart. At least 2 meters apart. Stay at home, which we have already elaborated very well. And don't touch your face, the eyes, the ears, the mouth. I think this has also been explained very well. And don't spit in public. If you use your handkerchief or a tissue, throw it away. If you use a handkerchief, you should wash it and iron it with a hot iron.
Right. And if you have to sneeze and it catches you, because sometimes sneezing just comes suddenly.
Just feel like
before you quickly get out your hand, then you...
or you say sneeze into the elbow.
Into your elbow.
Because that's what the Honorable Minister was demonstrating when...
Exactly, so that you don't contaminate your neighbors.
So either you don't sneeze into the hand, you sneeze like
this.
Don't
sneeze into the hand, because you are going to contaminate. You may even forget and contaminate people.
Okay, so sneeze into the elbow.
Surfaces. Okay. So sneeze in the elbow. If you are seated or in any group, try to keep a distance of at least 1 meter. I hope this is 1 meter.
This is about an arm's length. So it should
yes, we are doing well.
Almost about an arm's length.
I think so.
Okay,
so try as much as possible to avoid. This really means you should avoid overcrowding.
Avoid overcrowding.
Avoid overcrowding. Keep a good distance, because you don't know what your neighbor is holding. So try to keep a good distance and touching your face.
If we can do this, we're going to prevent so many different infections. The other colds, the chest infections, skin infections, the choleras, the worms which we have.
Enforcement of the actual public health requirements. Yes. Because if you say that a vehicle is supposed to carry 5 people or 4 people, let it carry 4 people, then enforce it. But don't let someone get away with carrying 9 people and you don't do anything.
Yes. But also, on a serious note, we have also put in place very stringent mechanism, especially the initial control at the airports, the initial control of screening each and everybody. You realize that most of our cases, we picked them from the people who were returning, the visitors. If you realize among most of our cases, we picked at the airport, and even those who are positive now were really picked from the quarantine cases, the people who had quarantined. Even the few who went in the community were actually the cases who had come from Dubai, where we had initially not got the right information from the WHO statistics, because we thought initially that Dubai was not a very high-risk country. So I believe the measures we put in place initially helped us to filter out and capture all these cases, put them in quarantine, or test them and isolate them. We have also put in place stronger measures of prevention. The messages have been loud and clear from all quarters, including the highest person himself, who has been personally sounding this message. Wash your hands, don't touch your face, social distancing. So the message has really gone around. Even if you go to the village now, everybody will say, don't shake, don't greet me, don't shake hands. The closing of schools, the closing of churches, the lockdowns. So the interventions, people were laughing at us and say, you don't even have a single case and you're closing schools. You don't have even a single case and you're closing airport. But now, all those who were saying so have converted and said, oh, I wish we had closed the airport a week earlier. So I think the interventions were strong.
The interventions are very strong and timely. Although some people say we even delayed to close the airport.
If you look at the cases we got, all of them were in the last week before closing the airport. We are providing the protective equipment related to the assignment. If you are responsible for treating for collecting samples, there's particular equipment you are provided for. If, like, for instance, you are a lab person in Kanungu and your role is to pick samples from the community, you have particular equipment which is provided to you for collecting samples. Okay. The people who are in treatment centers or isolation centers are also provided with relevant protective equipment for treatment of those patients. Okay. Then all other health workers, we have sent them the late protection that they require, like gloves and masks. I want to urge my health workers here that you don't need to don everything and gown and everything like you are going to the moon just to treat an antenatal care mother or to immunize a child. All you need is a surgical mask and gloves. And that is adequate for you as a health worker, treating all other cases in a health center.
What we need is that surgical mask, and it is able to filter out more than 95% of particles or germs which come, including viruses, which come in contact. And that, as we wear gloves, as we handle patients who come to us, clients who come to us, and we wear the masks, we are adequately protected. And this also gives us the protection, because sometimes a person who is coming to the health unit does not necessarily come with a label that I have coronavirus. No, it's only after the assessment. Minimum. It is that basic minimum, and it is adequate. And we are quite concerned about this, because they may feel that they are partly protected. Unfortunately, they may not be undertaking enough measures of the hand wash, and you cannot have a glove, yes, and you cannot sanitize the gloves, because the gloves 80% alcohol will create holes into it. So it is not. So
meaning people should not use
the gloves. Are not. They are not the right thing to do.
So what should people do?
And you can imagine, you may touch the doors of a vehicle, of one vehicle, or somebody's bags as you are touching it, and then you move it to the next one. Or rather, in between these contacts, either the person wash their hands or use the sanitizers. The gloves are not a very good thing, and we're quite concerned about that. Two, we also see in the public there are some people who are especially picking either the surgical masks or the N95. The N95 are really very precious masks currently for us. There are very few in the country, all around the world. So as much as possible, we would like to discourage the public from using them so that they are available for our health workers to use in these treatment centers. Because in the health units, that is where the disease is concentrated, so that the few are available for the health workers.
So what we did with those people coming from those high-risk countries, we would advise them. Of course, first of all, at the point of entry, let's say airport or immigration office in Busia or Malawi, you would check. If he has no symptoms, then you would give them information and say you should go. Those coming from high-risk countries, the 16 which we talked about, but now they have even increased. Let's give as an example, if you are coming from China, we would say go and do a quarantine, you self-quarantine in your house. Don't get out for 14 days. They bring you food in your room. They do everything in your room.
So you just stay at home.
Just stay at home.
You don't go to
not
the
even
shops.
Interact with your own members of the family in your own home. Actually, should stay in your room. They bring you food there. Have your own bathroom and the like.
We determine how long it will take before we get to the next wave. Yep. We determine how far the wave will go up based on the behavior, because there are factors we might not change.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Vaccine is what is given to individuals, in order to protect them against disease. Okay. So it's not the same as treatment. Treatment is given to people who are already infected or are sick, but a vaccine should be given to an individual to prevent getting infected.
Okay.
I think we are what we are, and we are living, our children are living because, many of us, because of the vaccines. We are used to childhood vaccines. Vaccines have been there for a long time,
okay.
And they have prevented many deaths, especially for viruses where we don't have treatment. So really it is given to you to prevent infection, getting infected. Sometimes,
okay. Yes.
Yeah, sometimes, and this is not new with COVID, you may get infected, but it will prevent you from getting severe disease and death.
From the outset, we said these vaccines will not prevent infection. The virus will find its way into you. But what the vaccines do is they prepare your body to fight and suppress those numbers of viruses to so low to an extent that it cannot inflict severe damage on your organs to progress to severe disease and to death. So the vaccine prepares your body to fight off that infection. Now, if it keeps the numbers low, you who was supposed to have symptoms may now be without symptoms. You who was supposed to progress to hospitalization may only have mild symptoms. And indeed, for us, what we have seen is that most of our colleagues who are vaccinated and who got infected have remained with the mild symptoms or without any symptom at all.
God, who made us, made defense mechanisms within our body, and we have the immune system. Very, very important. This immune system has kept us alive. It defends us from a lot of infections. Wherever we are, there are a number of infections we get exposed to, but the body then produces what we call either antibodies or T cells, so that when you get again exposure, you meet that infection again, the defense is there, the army is there to protect you.
This defense is within the body.
Within the body, your body. So normally we see it when you get infected, let's say with measles, yeah. Then if you survive, the body remains with the army, the soldiers, that will be ready in case you get
another
measles. So in vaccination, instead of getting natural infection, you are given the vaccine itself that will trigger your body to produce these antibodies and T cells, so that next time when you meet, let's say, that same organism, the body can quickly produce those antibodies and T cells to protect us against you. If it's not to protect infection, then it will also help you to reduce, on when you get infected, it will reduce on the multiplication of the virus, the viral load, so that your disease is mild and you don't get severe disease. So it's the soldiers within their body that will really fight for you when you get exposed to any infection.
Very interesting. So you mean to say the vaccine kind of provokes this defense system in the body?
Exactly.
To fight against the infection to which it's supposed to be armed against.
Generally, for control of diseases, we have priority groups set based on vulnerability. So which groups of people are those who are most affected? If it is measles, we say children. If it is meningitis, we say below 30 years. If it is yellow fever, we say below 60 years. Now, in addition to this targeting by vulnerability for vaccine-preventable diseases, COVID has come with another dimension. In addition to vulnerability for severe disease and death, there is also the issue of vaccine availability, so that the few doses of vaccines you have, you would want to use them to protect the people who are at the highest risk of death and severe disease, so that those who can fight off the disease on their own, which fortunately is about 80% of the people who are infected. Their vaccination can be delayed if they are in the category which is likely to be asymptomatic. So therefore, we prioritize, because of vulnerability for severe disease and death, we also prioritize so that the few doses which we get give us the maximum benefit by targeting those who are at the highest risk.
The vaccines themselves are doing really well, so that even when people are infected after full vaccination especially, we find that hardly anyone is dying. Very severe disease, hospitalization and death is actually reduced. But still, if we have drugs to add to that, then we can do even much better for those that become sick. Then there are those who might be vaccinated and they don't mount their full immunity. People who have conditions that make their immune system, vulnerable, and they cannot quickly mount that protection. People who are taking drugs that cause immune suppression and others might not necessarily fully mount that. So, but fortunately, that's a very, very minor proportion, but still we have to plan for that.
Generally, for control of diseases, we have priority groups set based on vulnerability. So which groups of people are those who are most affected? If it is measles, we say children. If it is meningitis, we say below 30 years. If it is yellow fever, we say below 60 years. Now, in addition to this targeting by vulnerability for vaccine-preventable diseases, COVID has come with another dimension. In addition to vulnerability for severe disease and death, there is also the issue of vaccine availability. So that the few doses of vaccines you have, you would want to use them to protect the people who are at the highest risk of death and severe disease, so that those who can fight off the disease on their own, which fortunately is about 80% of the people who are infected, their vaccination can be delayed if they are in the category which is likely to be asymptomatic. So therefore, we prioritize, because of vulnerability for severe disease and death, we also prioritize so that the few doses which we get give us the maximum benefit by targeting those who are at the highest risk. If we vaccinate and decongest the hospitals, we also protect ourselves from, as health workers, from burnout.
Exactly.
High burden, high workload is very devastating for the healthcare workers, so that because they will burn out, they fail to concentrate, they get infected themselves, they may not be very professional. So there are many, many other knock-on effects which come as a result of overwhelmed health system by numbers of people who are infected.
Vaccines are safe. The main side effects people get are the common ones when you get vaccinated, especially pain at the site of injection. Some people get some pain. Others get a little bit, feeling a little bit fatigued, a little bit unwell, and say, I don't feel my normal way. Yeah. So that comes about. Others get fever, and that happens in many vaccinations. Yeah. So those are the more common. Somebody tells you, I had the vaccine, I felt a little bit tired, I didn't feel like as active as I normally do, and that is usual. And then there are many who feel nothing. So these side effects normally come for any vaccine because you have been given something foreign, a protein, and that stimulates your immune system, especially what we call an innate immune system that causes some inflammation, occasionally some fever and all that. So that is common.
Okay.
Now, the serious ones, the very serious ones, which the people who have said, I've had some fever and I felt maybe I need to stay at home, maybe go and see a doctor. And all these are being recorded. There are those who have said, I felt like seeing a doctor. And those, but we have not had these alarming bad effects of the vaccine. Especially we shall talk about the clot. Do you want to talk about the clot now?
Yes, you can talk about it. Yes, you can throw more light on it.
Maybe let's throw more light. I think people have worried more about the clot, but the chances of, first of all, the association has been very difficult to get. It's mostly been associated with two vaccines, the AstraZeneca, which is being rolled out, and Johnson vaccine. And the common thing about it is they are using vectors. One is using a vector, using a virus from a chimpanzee, a chimp adeno-vector to carry the proteins of the vaccine, and another one uses a human adenoviruses. That is the common about these two. But if they're getting the clots is very rare. They say about 4 individuals out of 1 million. So about 1 in about 250,000. Yeah. So the real chances are very, very low. And if this is detected early, of course, people will get headache, people may get blood, vision, abdominal. If you're managed quickly, then we can prevent death. So I can say the risks of such clots, if you compare them with the benefits, if you have COVID, the chances of dying, the chances of even getting clots are much higher. So that's why we're saying even
with the COVID disease.
The COVID disease
when
itself,
you get COVID, the chances
disease,
of getting clots are much higher.
You can get clots. The chances are higher than even with the vaccine. And death. So the risks versus the benefits, we are saying it's safer to be vaccinated. And that's what WHO is saying.
You are watching the Doctalk Show.
Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Patriotism is a feeling of love, devotion, and the willingness to sacrifice for one's country.
I say no to corruption because I put my country first. I choose peace over violence because I put my country first.